Hi everybody, I'm Franic Geoghegan, and lovely to meet you all. I'm sure there are lots of people in the audience who have never managed to see face to face, but I'm sure I've spoken to lots of you, and it's always a pleasure. We love when you interact with our service. I'm going to talk about some of the good things about Ealing Pathology this evening, and also some of the things we need to do a bit more work on. Okay. So I've given the official smiley sign to those areas which constitute requisites for the top quality service in pathology that we feel we're doing quite well in, okay? Namely people, quality management, governance, environment, analytical technology, information solutions, and communication media. Ealing Pathology has come on a long way in recent years on those fronts. Areas where there's more work to be done include the ordering of databases, and that is very much a symbiotic effort between the service user, particularly how you order tests, and the pathology department itself, how we book the request that you've asked of us. Okay, and enabling of demand control. Obviously, it's one of the topics of the evening that we need to keep working on. Those, believe it or not, all the people that work in Ealing Pathology. I stacked up a number and I was amazed to tabulate 70 different names of people who are intimately involved in our department. Fantastic team, great place to work. Everyone putting together to give you a good service. And remember that we are a spoke service. We operate a hub and spoke model with our pathology provider, TDL Pathology, which is based in central London. That's the breakdown of individuals by specialty in the department. And I'm sure everyone's aware of this public-private partnership between Ealing Trust and TDL, and NHS Ealing and TDL, which has served us well since 2007. Okay, we have a good quality management governance structure. We've got an on-site quality manager full-time, and he's supported by the corporate infrastructure provided by the doctoral laboratory, and all their activities are closely intertwined with the governance structures within Ealing Trust per se, to only give you a safe and reliable service. Okay, a few years ago, I don't know if anyone was ever in Ealing Pathology a few years ago, but it was really in a sorry stage. You go in the morning and your heart would sink. It was, it drove low morale, and in particular drove error, I'm sure. Very difficult to create an organised service within such a disorganised department. So this is how we used to be. I don't know if I hope the pictures are relaying, but we have a dark, cluttered corridor infrastructure, for example. Just junk all over the place, and it really was very, very demoralising, and again, very, very difficult to drive organisation. We had some old fridges. We used to keep the stored samples in. We used to break down now and again. That's one of the doctor's office, very, very tatty. And what those pictures don't confer, really. I mean, if you have a little game of word association and you use the word laboratory, people always say sterility, this, that kind of stuff, and it was, diametrically the opposite. It was those pictures don't convey the grime, and how depressing it was to be there. It really wasn't a good situation. But now, I think Adnan was one of the people who deserve great credit. A few of us knuckled together, so in 2006, 2007, decided, we're going to do something like this. We never get an ordered service unless we do something like this, and we had a fantastic program. You walk in now, it looks like a serious organisation. That's our specimen reception area where your samples are arriving to us every day. That's our automated laboratory with fantastic technology. The one on the left there, that's chemistry analyzers, 1,000 tests an hour. That's where we store your samples after being analysed, all very accessible for any add-on investigations that you may require. Good doctor's offices and a fantastic meeting and seminar room. We have a great culture of education now for all our team within the department. And again, more good staff facilities, nice kitchen, etc., etc. Okay, so that's the environment. Next thing we were weak on was communication media. Someone was talking about standardised request forms. Well, that's difficult because pathology services tend to produce their own products for their service users to use. And in Ealing's case, we decided to introduce some fresher request cards which are colour-coded in a way that reflects the work streams. Okay, so they go to actually physically different parts of the department to get processed. Those are microforms, histopathology, blood transfusion, and blood sciences genetics. So the colour actually has a purpose. And within the trust itself, the results viewer system called SunQuest ICE displays the results for the different disciplines under the matching colours for the disciplines. Okay, as a follow-on from that, and I heard someone actually asking, I'm sure, about blood tubes and the correct blood tube for a given test down the road. We've also more recently released an electronic laboratory guide available on the Ealing Trust internet site. Hopefully people are slowly discovering this. It gives you information on the available repertoire of investigations, which Arjun was trying to trim down, the Ealing Pathology issue form and sample carrier that you need for each test, and just advice on form completion and sample identification, so that basically, I talked about the symbiotic relationship and you getting it right as the requester. It just means that you get the right information that we need and the right sample carrier that we need to get your test done successfully. Okay, so if you're in the health professional section on the Ealing Trust website, you will find this product and have a look. It's quite nicely done. We got the help from an external web designer and he did a really nice job helping us to e-realise the product. That's an example of the tubes and the little abbreviations we use in the guide. So, for example, if you go to the alphabetic listing of blood tests and go to number O, for example, if you want to get ordered estradiol, and you move your cursor over, you get a pop-up of a particular formula we want you to use, and you'd also get a pop-up of the particular blood tube we'd like you to use. And if you click on the additional information, you get the turnaround time for your test, where it's actually done, who you can ring for clinical information, etc., etc., etc. Okay. That's a micro test, and that one is omissions and parasites. That is a blue form, and a different type of container is shown there. Okay, quiz time. I thought we'd have a little interlude, and obviously demand control is one of the topics of the evening. How much work is the service completing for you? Anyone would like to have a guess at the number of full blood counts done by Ealing Pathology for general practitioner service users in the last financial year? Think of a number.
Go on, quicker.
200,000.
200,000.
Okay.
500,000.
Very reasonable guess.
Any advance on 200,000?
Okay. What about renal profiles? UNEs? Same. 400,000. Okay, we're being a bit generous, I think, but we're talking the right kind of big numbers, probably a little bit over the top, but thyroids?
50,000.
Yeah, okay, very good. That's a good guess. Lipids?
40,000.
150.
Far too many.
Very good. I heard Dr. Waters with a very sensible suggestion there. We won't go through everything, but I'll show you the scores in the doors in a minute. But there's a very topical test, vitamin D. And vitamin D is an interesting one because we're starting to do huge numbers of them. And unlike, I mean, you can categorise the top two tests certainly as, you know, they're not very expensive, but you're going to get down to some tests that actually are quite expensive. So vitamin D is very much in that category, you know. Arjun was alluding to the commercial sensitivity of some of the costs per test offered, and the funny thing is we're not completely sure what they actually cost because they're not, the cost of the models for the tests are actually a little bit elaborate. But you're talking about 20 quid just to get a cat in the bag for vitamin D every time, you know. And given the activity around the block, and some of the providers love it, but it's the cumulative spend is potentially enormous. Okay, I won't just. I'll show you the numbers. Yeah, so those are activity data. So nearly nudging 100,000 for a lot of these. Ferritin was like for 44,000. Vitamin D's 34,000. So huge activity, and obviously saving money is now flavour of the month. So there's plenty of food to talk. Okay. Yeah, by extension, because we're doing so much work, receiving so many requests, you can preset also that this means that the service is receiving an awful lot of pathology request forms. Okay? And this is something as service users we beg you to assist us with. This is a big, big problem that we have at the moment. So I've been advised by specimen reception now that we're now getting about 1,500 forms during a daily basis. Poor quality completion is a massive hindrance to optimum functionality of the service. That's stating the obvious, isn't it? Okay. Now, if you can picture yourself as a member of staff in specimen reception who's booking one of these tests that come in every day, this is the information that the lab IT system is looking to you to translate from the request card to the lab IT system. And, if any of this information is not there, it lives with the request forevermore and it compromises the quality of the record for that particular patient. And once it's gone wrong, it's almost irretrievable. We are collectively still hindering ourselves and placing patient safety at risk by substandard requesting practices. It's much safer for all records to be filed as a single record under a single identifier. Stands to reason. Not to mention a basic entitlement. I kind of like being through the NHS myself. I prefer if someone really could click on my number and all my test results historically could come up. And I think to a person that's a pretty reasonable ask, And historically, across the patch, we've allowed a little laissez-faire culture to develop where, it's basically okay to write pretty minimal detail on a form and the test will still go through. And pathology is very, very comfortable in that respect. We, kept the bar at too low a standard and we should have been chasing down this information and demanding a bit more of the requesters as well. Okay, another situation is I was just thinking of, imagine trying to get the DVLA on your side, get a passport, get on an aeroplane down the road to Heathrow. If a lot of the requests to those bureaus were made with the quality that we received, you just wouldn't have hope of getting to the end product, And I think we need to be a bit stricter about this together. That's on the Sunquest I system in Ealing Trust. That is the legacy of sloppy requesting. This is bottom 3, and all that is one patient. And you should be able to click on one bar for one patient. Everything should come up. Because of what we've been doing over the years, that's what we get. And the trade-off of that is that now pathology is submerged with requests from staff in the trust to merge these patient records, Here's a good example. I've truncated the name there, but, who wants to point out what's wrong with that request form? Yeah? So, Paul, in what way is it not filled out?
Wrong
Thank you. Correct?
Wrong form.
It is the wrong form, thank you very much. And not any, absolutely.
And no NHS number.
No NHS number.
No
Excellent.
request.
Yes.
No clinical. Well,
Yeah.
there is
Okay, well, presumably, we often find people actually scribbling in the sample because the form was written in advance, but no, this was a GP order, GP request. There was no practice detailed, no NHS number, and just, there was no gender reading for that. And that's just very unsatisfactory. I'm sure everyone can appreciate that. Now, I'm not knocking the practices. I've just wonderful experience. I'm not just saying it because I'm standing here, but Adam and I would say we wonderful experience of our GP community. We love you to bits, and we're just it's a fabulous rapport that we have. One of the little problems is if you think about 1,500 forms coming in every day, and again it comes back to our friend who talked about standardised request forms. We are getting, we call them homebrew forms in the department because they're customised by individual practices, which is fine, so they can be embedded onto their IT systems. But again, in pathology, there's a little bit of a difficulty that there's pretty much for people who generate off their own bats request forms, a different form coming from every practice, and there's a little bit of scope for error there. Let me just throw that to the floor, just for further thought. Okay, so wonderful practices, but just different forms from different places. Stuart said, in terms of patient identification, it's all about this. Okay, one of my great ambitions is for every request to come into pathology with the NHS in the world. It would be so powerful in terms of creating a uniform record for every patient. Okay. And the GPs are the best at it, actually, I should say that. In the trust, it's a big, big weakness. Okay, the GPs are the best. In spite of that form I showed a minute ago, the general practices are very good. So keep up your standards and please raise the bar as high as you can. Okay, so I'll just be a demi second. Demand control. Down the track, in our perfect world, we would probably have everyone with electronic requesting solution and when they try and order a test, if they're maybe ordering a test for the second time in the week, for example, because someone maybe in the hospital has ordered, they will get a pop-up message saying, sorry, you've had this done, do you really want to get this done? You probably should. You know, and the potential savings from that are absolutely enormous. And again, if we want to have that world, if we're striving to that world, we obviously want one patient record that requesting solution can interrogate when you're trying to find that test. If there are 6 records for patients in the lab database, the requesting solution won't know which one to talk to. Nearly finished. This is TQuest request form. This is everyone familiar with TQuest? Some practices come across it, okay? We get some feedback, I hope, over the course of the evening, but obviously the pathology modernisation programme of NHS London are really demanding, effectively, or strongly recommending that healthcare areas use electronic testing solutions, and Ealing Pathology, the pathology provider for Ealing Trust, is implementing around a lot of the practices TQuest for Indigo 4. 13 practices are currently live. We do have this consistent presentation of form, which is an advantage, but it would be interesting to hear what people's experiences are. Okay, the last couple of slides, Paul. So, well implemented and configured only, because if they're not well configured and not well implemented, you're probably better not having them in the first place. But these solutions will surmount some of the difficulties associated with the use of paper-based requesting. However, paper-based requesting is not going to go away in a hurry. It really won't just disappear overnight, and we really need to raise the bar and make sure we're very, very exact in our requesting standards, so ensuring that we've got a single record for given patients. And really, what must be remembered, it's incredibly straightforward to write a paper request form with complete accuracy, and at the end of the day, you don't need to spend hundreds of thousands of pounds on an IT solution actually to achieve what we want to achieve. Quickly, in the area of requesting and demand control is my last point. Just an area that we do have a little bit of issue with from our general practice service users is what we call sort of nebulous requestings, and even in the trust as well, with people not really pinning down the tests that they want, but writing a sort of generic test. Tumor markers, autoantibody screens, they're a bit of a problem for us. And the thing I tell you about those is that autoantibody tests, for example, this is a huge problem. These are very, very expensive tests to do, and if we're just block requesting lots of autoantibody screens, the potential waste is absolutely enormous. There's another example from our one of our excellent practices, just writing autoimmune profile. Someone in the specimen section area doesn't really know what test to order, and that's something we should think about. And that's enough from me. Thank you very much for listening.